Holy crap, guys. This is the 4th time I've tried to do this. My phone keeps freaking out, telling me to take my medication, and I'm not home. Anyway, I am at Mayo. I just got done with my appointment, and I was here to see, or I thought I was here to see the surgeon. I didn't see the surgeon. I saw the nurse practitioner that goes through all the paperwork for the prior authorization from the insurance company. So we went through all that. She asked me a million questions, got everything squared away, everything filled out. She discussed with me the 3 different surgical choices that they offered: the gastric sleeve, the Roux-en-y gastric bypass, or the duodenal switch. I'm really glad she said it out loud, because I've been saying duodenal switch. I've heard other people say duodenal, and so I didn't want to say it wrong. She said duodenal switch, so I'm going with that. Anyway, I feel like I've just been talking forever and nothing has happened, and it's all because my phone keeps screwing up during these videos. So anyway, we discussed the 3 surgeries. I have roughly 200 pounds that I need to lose to get down to what is considered a normal weight for my height. I am only 5'1". I'm barely 5'1". So what is considered a normal weight for me is actually quite low, and there is kind of a threshold they have for what they consider to be a success for the surgery, and that's to get you within the overweight range of BMI. And if you're in that range, then they consider the surgery to have been successful. They give you like 2 years to accomplish that. And if you get to what is considered a healthy weight for your height, awesome. But as long as you get into this overweight phase, they consider it a success. So we discussed the different surgeries and what would work best for me. While the duodenal switch does offer a larger amount of weight loss, it also possibly could cause more issues afterwards that would require me being down more and needing more care. There are definitely more appointments. They have you come in more often for blood work and to see the surgeon and to see her and to make sure that you're doing okay. Being that I have 4 kids, 3 of them fairly young, and that I will be starting a full-time job here in a couple weeks with the school district, she felt that the Roux-en-y would be the better choice because there is less of a chance of complications, because it is kind of their gold standard. It is something they've been doing here at Mayo for 30 years and something they're quite good at. Being, the things that I want to accomplish with this, and the amount of work I put into it so far, she thinks that's just her opinion, that would be the best surgery for me, that I would get the most benefit and the least risk, and would just fit best. And I kind of agreed with her. I'd been on the fence. I had started out wanting the sleeve, and then when I saw the low level of weight loss, and how much I need to lose just to get within the range of being healthier. I'm having this surgery to reduce a lot of health conditions that have developed, and there's a large amount of weight that I need to get rid of those health conditions. So 75 pounds just isn't, just not enough. The Roux-en-y, she said, usually 100 to 150 pounds. Again, that would get me into the overweight section, and would get me into an area that would hopefully fix a lot of those problems. And we did discuss what did I want from the surgery? What was I expecting to get out of this surgery? And I told her I want to get rid of my sleep apnea. I've got severe obstructive sleep apnea, and I want to get rid of the sleep apnea. I want to get rid of the CPAP. I don't want to have to sleep with CPAP every night. I'm so, like, it doesn't bother me, but I'm just sick of the idea of it and sick of the constant. I have to have it to breathe. I can't. I've tried to sleep, not even on purpose, but I've tried to sleep without it, and I can't breathe. I can't sleep. I'm awake and gasping and miserable, and I don't want that. I don't want that for the rest of my life. So get rid of the sleep apnea. Get rid of the CPAP. Get rid of the high blood pressure. My blood pressure has been kind of right on the fence for years. Get it back to a normal place. I'm pre-diabetic, and I recently found out that diabetes is very prevalent in my father's side of the family, and I do not want to end up full-blown diabetic. So getting everything situated and brought back down to get me out of the pre-diabetic and to keep me out of being diabetic. A big thing for me is joint pain and not being able to move and not being able to exercise as much as I would like, not being able to participate in activities with my husband and my kids, not being able to do as much on the farm as I want to because my body just physically cannot do it. Either I have too much body mass and I simply cannot move my body. I mean, I can't bend over to tie my shoes. I tie my shoes and then I put my shoes on. And I tie them loose enough that I can slip them on because I cannot bend over to tie my shoes. So some of it is just that there's just so much that I can't move properly. And part of it is a joint pain and arthritis that has been developing. She said that when she had gone through my stuff, she noticed that my white blood cell counts had been elevated for a very long time. And they could not find a source of infection that would be causing the elevation or a source of the inflammation that seemed to be rampant in my body. I've been tested for things like lupus and rheumatoid arthritis several times now, and nothing comes up. So she said that she had seen in several people where in as little as 3 weeks after surgery, the inflammation either completely disappeared or was tolerable and made it easier for these people to move around. She saw these people that had these chronic elevated white blood cell counts for no apparent reason just go away. Suddenly, they go to the next blood test and everything is normal. And it stays normal. And they never have that issue again. That inflammation doesn't come back. Obviously, so long as you stick to the tool, using the tool, and you don't gain all your weight back, that's a whole other story. But just the relief from the joint pain, which has been such a huge burden for me, and such, I cried. I'm gonna cry right now. That's been the hardest part for me because, medications suck and nobody wants to be sick. But whatever, I can deal with taking horse pills, metformin. It sucks, but it's not the end of the world. However, my lack of ability to just function, to just be with my kids and be present in their life, that has been the hardest thing. To just not be able to move. Unless I'm in the pool. I'm in the pool, I'm like a freaking mermaid. But on land, I just can't move. And I can't participate. And I'm in pain all day, every day. And I don't want that anymore. I am so tired of feeling trapped in a body that does not work. And And that's why I'm doing the surgery. And that's why I'm pushing so hard to get this all done. I'm basically just waiting now for my insurance to authorize it, and then I will get to see the surgeon, and then bam, she said once it's authorized, it goes really fast. You see the surgeon, and you get your surgery date set, and you're there, and I can't wait. I'm crying, but I swear to God, it's happy tears. Just hearing her say that in only 3 weeks, people saw so much relief is, just unreal. And I so look forward to it. And I know not everybody agrees with this decision. I know there are a lot of people who have this surgery, and they do really well for a while, and then something goes wrong and they gain it all back. I get it. I've seen it. I know that. But really, even if all I get is a couple of years, it'll be so worth it. Oh. So anyway, I need to go, because I need to get to the grocery store and go get some milk and bread and stuff before the minions completely and totally drive Brian bonkers. He's been babysitting them for days now. I've been super sick. I was sick all weekend. I was in the emergency room yesterday. I'm feeling mostly better today, but holy crap, I've been so sick, and Brian and Ethan have been a huge help. They've really taken over taking care of the house and the kids, and just helping me out so that I can rest and do better. So I need to go get groceries so I can go home and I can relieve Brian before the poor kid's gotta go to work. Anyway, thank you for watching. I will talk to you all later.